report by the Committee on Health. And Madam Speaker, I belonged to that committee before committees were reorganized, and I had the benefit of visiting several medical facilities in this country, Madam Speaker. And although the report in question is about Trans Nzoia, West Pokot, and Turkana counties, Madam Speaker, but the problems and challenges that we encounter in these hospitals are almost similar. Madam Speaker, most of the hospitals, like the committee found in Trans Nzoia, do not have adequate security walls. And this is a challenge because, Madam Speaker, especially in the light of the murders that have been happening in Kenyatta National Hospital, this is a challenge to the security of patients who may be admitted in the wards of this particular hospital and other hospitals, Madam Speaker. And so I think it's important that we call upon all the governors and their executives in charge of health to see to it that hospitals are well secured, Madam Speaker, in order for any patient that may be admitted in these facilities to be safe. It is very sad, it could be very sad that somebody goes to a medical facility to seek wellness, only for them to lose their life while in hospital. It beats all logic. And so security of medical facilities, Mr. Speaker, is something that all counties need to work on. We also have a challenge when we don't have these security walls, because patients could also escape without notice, because sometimes a patient could have bills, sometimes a patient could be disturbed mentally, and they could actually run away from the facility, which again would cause untold suffering to the families of such patients. And so security walls around hospitals and surveillance must be something that the counties should invest in. Availability of ambulances, Mr. Speaker, and I have raised a statement here which has been expedited on by the Committee on Health regarding deaths that happen, especially one particular death that happened in our county resulting from lack of an ambulance when the patient was supposed to be able to be attended in the shortest time possible. And so this unavailability of ambulances is also something that county governors and their health departments must look into. This is because ambulances are not stationary, and that we understand. Because of course, when you could even have 3 or so ambulances in a particular hospital, but all of them could at one particular point in time have taken out patients. And so it is important that county governments invest more in ambulances because sometimes saving a life is a matter of seconds, of minutes, if not seconds, Mr. Speaker. And so this is not a problem peculiar to Trans Nzoia. It's a problem that affects most of the counties. And I'm glad that the Committee on Health was able to identify these as one of the problems or one of the challenges that face our health facilities. When you look at the medical negligence that is there, Mr. Speaker, with the medical staff, sometimes because their morale is low, because maybe the contractual agreements are not very friendly to them. And of course, in this age of lack of jobs, somebody then signs in any job that comes around. I think it's important as counties do their budgets to allocate more or sufficient amounts of resources in order for them to see to it that all medical staff are highly motivated by way of pay and also by the conditions of the environment of work at the hospitals, in order for this very important service to be offered by people or by staff that is highly motivated and ready to deliver. Mr. Speaker, I have had, I'm proud to hear Senator Mongatana, giving accolades to my county. And it is true that in my county, all health facilities and all health activities and operations are digitized. We must encourage all counties to digitize their operations in order for them to prevent even, loss of drugs, and to also control personnel, because when we can be able to know remotely who has reported to work or who is doing what they're supposed to do and who is not doing what they're supposed to do, then it makes management of these health institutions easy. And so it's important for counties, Mr. Speaker, to digitize their operations. In any case, this is the age of digital literacy and digital operations. Mr. Speaker, these health workers, this, if you ask me, is the most important activity or the most important service that counties offer, health. Because we can live without an education, Mr. Speaker, and I say that with due respect to my professional colleagues, the teachers. We can live without an education, but we cannot live without good health. And so I think even as we allocate monies to education, we need, as counties, our counties need to allocate even more on health. And this is a major devolved function that counties have. Because for education, of course, counties deal with only ECD centers, Mr. Speaker, and vocational training centers. So we should have enough in our budget to cater for good employment terms for our medical staff, and to also cater for the medical equipment and medical drugs and reagents, Mr. Speaker. When you go to West Pokot, there was non-operationalization operationalization of specialized medical equipment. And this is a challenge that we have, especially with far-off counties, that they have equipment, but they do not have trained technicians to run these or to operate these machines. And I think before a county invests in specialized medical equipment, they should have in mind and they should have taken care of the fact that there needs to be specialized staff to deal or to operate this medical equipment. And this is something also that affects many other counties, especially those in far-off places, Mr. Speaker. And I think the health committee did a very good report and noted these problems, Mr. Speaker. One other challenge that we could find when we used to make this county visit, and I can see the Senator of Kisii is here, and we visited his county when I was a member of this particular committee. is preservation of bodies. That some counties do not or have not invested in preservation of bodies, Mr. Speaker. And you know, we have to take care of the dead as human beings, because these are loved ones of some people. And so counties must also invest in this particular area, Mr. Speaker. It's an area that people don't like talking about, but it's an area that it's a facility that every facility needs to have in order for them, because, I mean, it's appointed for every man to die. And when they die, good care should be taken of them. And so this is something that counties also need to think about, Mr. Speaker. And I think the many other things that the committee recommended are good things, and things that will help service delivery, especially health service delivery in our counties. And Mr. Speaker, I do not want to take too much time. I just want to say that I support this report, and I challenge also other committees, other committee chairs, to also do their reports and bring them here for us to be able to debate and also give our ideas on what we think of the report, so that, Mr. Speaker, we can all add our minds and our ideas into the things, or into the ideas that our different committees in this House have. And with that, Mr. Speaker, I support this particular report by the Committee on Health. Thank you, Mr. Speaker.